A good evening to all of you. Thank you so much for watching Family TV. Of course, I know you started watching from our early morning programs up to now. This is Health Pot, always on Friday at exactly 7 p.m. And this program is brought to you by Makerere University College of Health Sciences, Makerere University School of Public Health. Therefore, each time, every Friday at exactly 7 p.m., we are right there in your living room or right there on your phone, you who is watching us using your phone, YouTube, or through our Family TV app. Thank you so much. And remember, in this program, we specifically look at maternal health and early childhood development. So, we are grateful that Family TV has provided this platform for you out there to learn. Researchers come here and they share with us what they have to share, so that we benefit, you benefit, I benefit, and we save our tomorrow, we save our future. Even today we have our guest, and this is Dr. Olive Namugga. Doctor, You're most welcome to today's show.
Thank you, Edrine, for hosting me. We
are grateful that you spared some time to come. Dr. Namugga is a researcher from Makerere University School of Public Health, and today we want to look at, of course, there are a lot of myths, a lot of threats that if someone is HIV positive, so they cannot give birth, or if they give birth, they'll give birth to children who are also HIV positive. And today, Dr. Olive is going to take us through this whole process. If you are a mother and you're HIV positive, can your child be safe? And should you be worried that your child will be infected or not? Doctor, we are glad that you're going to take away all the worries that mothers out there have. Maybe we to start with, can you take us through this one? Because we look at a mother who is HIV positive, in whichever way they got the virus, and they have to give birth to a child. But what should they do? Or can they give birth to safe children?
Yes, Edrine, and we will go through the steps that will help these mothers to see that they can actually give birth to children who are HIV negative.
I've underlined with my fingers the answer, yes. So I'm now glad that very many mothers out there are saved, are relieved. You've talked about steps. Yes. What are these steps? And how many are they?
So I can't give a count, but we will just walk with this mother. We'll show what we do for a mother from the time she's pregnant to the time she delivers her baby, and up to the time she's breastfeeding her baby, and onwards. So during pregnancy, we encourage our mothers that as soon as you know you're pregnant, please come to a healthy facility near you, and there you'll be offered an HIV test. So currently we have what we call provider-initiated HIV testing and counseling. And this basically means that you're offered an HIV test. You don't even have to ask for it, because it's routine now that every pregnant woman is given an opportunity to test for HIV. So we encourage our mothers out there that if you know you're pregnant, please come to a healthy facility near you, and you'll be offered a free HIV test, and the results are immediate. So
I look at this mother who is sure she's HIV positive, but she's pregnant, and she's on medication. She's taking her drugs already.
Yes.
So does she also need to take a test, or this is enough proof that she's sick?
That is enough proof, but still she needs to come and attend antenatal, because there's additional care that we may provide for this mother. Because remember, even someone who is HIV negative still has to come and attend antenatal. So we encourage mothers, even when you know that you're HIV positive and you're ready on your medication, please come and attend antenatal as soon as you know that you're pregnant. So for those who don't know and are tested and found to be HIV positive during pregnancy, they are started on the antiretroviral drugs. And usually this is to be taken for life. And during pregnancy, it's serving two purposes. It's protecting the mother, but also helping to prevent the transmission of the virus to the unborn baby. So that's why we encourage mothers to come and seek these services, because one, it's helping her as a mother, and also it's protecting her baby. So maybe briefly, for our viewers, you can actually infect your baby with the HIV virus during pregnancy.
How?
Or at the time when you're delivering, or during breastfeeding. But
because now I speak for the mothers out there. The commonest ways they think are during birth and during breastfeeding. How can it be during pregnancy? Because earlier or days back, mothers who are HIV positive used not to breastfeed the babies, because they were told you can easily infect the child through breastfeeding. But they have no worries when they're pregnant. They don't know how they can infect the children when they're pregnant.
Actually, a small percentage can be infected during pregnancy. But the good news is, if you are taking your ARV drugs, that risk is almost reduced to zero. So that's why we encourage mothers to try and come, because the risk is there, but it can be reduced to zero, almost zero, if you start your ARV drugs and take them well. So the other time that this mother can infect her baby with a virus is during delivery, like you said. So even during delivery, we encourage the mother to continue taking her ARVs, but also we encourage them to deliver at the healthy facility so that they are assisted and given that special care. I should say special care, but it's best if they are delivered by a skilled birth attendant. So we encourage all mothers from the time when they're attending antenatal that please make sure you deliver at a healthy facility and where your HIV status is known. And if you go to another facility, just inform them that I'm HIV positive so that you can be assisted. Move with your records, move with your drugs so that you can be assisted.
Is there a special care given to mothers who are HIV positive that is not given to these other mothers that are negative?
I can't say that it's special, but there's more vigilance.
You know why I asked that? Mothers are funny. A mother will go to the health facility and say, I'm HIV positive, because they think there is something special they give these mothers.
I can't say it's special, but there are guidelines on how you deliver.
So they're just guidelines?
Yes, they're just guidelines that we have to implement for this HIV positive mother while conducting the delivery. And the midwives know these guidelines. So when they know your status, and actually they are tasked to always know the mother's status so that they can implement these guidelines. Yes. So I can't term it special care, but I'll just say special guidelines, maybe.
I think that is better, because when you talk about care, people might think they're gifts, they're privileges they give them. So people will rush and say, I'm HIV positive to
No. It's just special guidelines on how to conduct that delivery safely so that you reduce the risk of the mother infecting the baby during that time. But also, it's to encourage the mother to continue taking her ARVs during labor and delivery, because still the risk is there if she doesn't take her ARVs. So it's partly that package. Yes.
Then you also said which other way?
So the other time that the mother can infect her baby with the virus is during breastfeeding, and still we encourage the mothers to continue taking their ARVs. So these ARVs are actually they are called lifelong ARVs, meaning you're going to take them for life. But the advantage is during this time, you're not just taking for you as a mother, as a person. It is also serving two purposes. It is improving your immunity and improving your health as a mother, but also it is it's eliminating the risk of passing on this virus to your baby.
Is that alone enough when a mother takes the ARVs in time, like they are guided in hospital? Is that alone enough to make this baby safe?
So there are additional guidelines that we have to implement. This includes also one, infant antiretroviral treatment, prophylaxis, I should say, not treatment. So that baby is given some antiretroviral syrup. And commonly in our setting, we are using a syrup called nevirapine. So that is an antiretroviral, and it's given to the baby for the first 6 weeks. So you find that if this HIV positive mother delivers at a facility, they are immediately given the syrup, and it's started on the day that the baby is born, and the baby takes it for 6 weeks. So
what is it that this syrup does in the body?
So this syrup is additional ARV. It's prophylaxis, really. It's additional protection, to put it simply. So the mother is taking her ARVs. What those ARVs do, they suppress the virus in the mother's system, but also the baby is given this syrup for additional prophylaxis. Okay. Yes. So aside from that syrup, we also have infant feeding guidelines. So this baby who is born to an HIV positive mother, like we've said, the mother can pass on the virus to this baby. So we have guidelines on how the mother should feed this baby. And this involves the mother exclusively breastfeeding this infant for the first 6 months.
Doctor, at that very point is where I want us to begin from when we come back after a commercial break.
Thank you very much, Edrine.
As you think about the Lord just taking over your case and you are no longer in the midst of it, and he says, fear not.
Demons from the mountains, scream and leave.
In the name of
Demons from the graves, scream and leave in the name of Jesus.
Welcome back from the commercial break. Yeah, I believe you've rested a bit. Now we are back, and I'm really happy that some people get their notebooks and pen and start noting down some of this information. Of course, that is also wise, and yeah, it is good to remind yourself. You can get back to what you wrote, yeah, and remind yourself maybe if you're missing out some information. This is Health Pot, brought to you by Makerere University School of Public Health, together with Family TV. That is why we are here. This program is exclusively on Family TV. That is why you shouldn't miss it every single Friday at exactly 7 p.m. Tune in. It will bless you. We are with Dr. Olive Namugga. She's taking us through the whole process of how mothers who are HIV positive can give birth to HIV negative children. But how can that be possible? It is what she's taking us through. Doctor, you were telling us about the guidelines, and one of the guidelines was breastfeeding,
yes.
or is breastfeeding.
Yes.
how does this breastfeeding work? Because this is one of the worries mothers have, and up to now, very many mothers don't breastfeed their children as long as they're HIV positive. Please, we want to eliminate this lie. We want these mothers to comfortably breastfeed their children. But how is it possible?
So thank you for that question, and I want to assure our mothers that the current guidelines are for mothers to breastfeed their infants, but this is done in a safe way in which the mother is taking her ARVs. So I just want our mothers to remember that it is safe to breastfeed your baby as long as you're taking your ARVs. So that is how it's done. And also, based on these guidelines, the mother is supposed to exclusively breastfeed. And by exclusive breastfeeding, we mean that you don't give the baby any other feed, not even water.
Apart from breast milk?
Apart from breast milk. The only time you may give something else is if it's prescribed by a health worker as a medicine, maybe to treat some illness.
Some mothers prescribe for themselves. They hear, friends, for me I used this, you can also use this. No, this also works better.
So we actually talk to our mothers, HIV positive mothers, and we remind them that this is actually something we are doing for the safety of this baby. So if the baby is sick, please bring the baby and we prescribe. Don't follow everything you hear, because someone will tell you something when they don't know your status. So we prefer,
it might have worked for their child, but
yes,
it will not work for you.
It may not work for you. It may actually increase the risk of you infecting your baby. So it is safe as an HIV positive mother to breastfeed your baby, but it's only safe if you're taking your ARVs and you're coming for continued care. Also, that baby, remember, is supposed to be attending the EID clinic. That's the Early Infant Diagnostic Clinic, which is available at all these healthy facilities.
Very many mothers don't know that it exists.
So maybe let's just inform them that as an HIV positive mother, after giving birth, when you come back to the healthy facility at the week 6 visit, you're supposed to attend this clinic. And the purpose why we have these clinics is that they follow up these babies. So we are going to show how this baby is followed up, maybe in a subsequent session, but basically this child is followed up to 1.5 years in this clinic. The mother is educated on how to continue caring for the baby while they are exclusively breastfeeding. The baby is given the other syrup that I told you about, called Nevirapine. But after 6 weeks, that syrup, that dose is over, so they have to start what we call septrin prophylaxis.
Is it one syrup that they, or it is the same brand, but you can get as most syrups as possible?
No, you're given a bottle.
Just one? On
the day you deliver, and it has all the doses for the 6 weeks. So the mother is, you show the mother how to measure the meals and give to the baby. So it's all in one bottle, and this is basically to try and make life a bit easy for this mother, because she has just delivered and you don't want her moving up and down looking for the syrup every week. So she's given the whole bottle, and that bottle is enough for 6 weeks. But we actually inform them that if maybe something happens and the drug pours or something happens and the bottle breaks, you can always come back and pick another bottle. The most important thing is to know that actually this is all being done to protect the baby, and the drugs are free of charge in this country, and they are available at all healthy facilities.
Public health facilities?
Public healthy facilities. I think even private. I don't work in
not
private.
Sure.
Yes, I don't work in private.
We can speak for the public.
Yes, let me just speak for the government facilities. Countrywide, these syrups are available and they are free of charge. Yes.
Okay. And then, we are still looking at breastfeeding. You've said they exclusively breastfeed for 6 months.
Yes.
And then After 6 months, do they test their blood for the children, or what
Yes.
happens?
So what we remember the clinic we mentioned, the EID clinic.
Yes.
So when the baby is registered in this clinic, one of the services that are offered is the baby is routinely tested for HIV at scheduled time intervals. So the baby is first tested at 6 weeks, which is 1 month and a half. So when the mother brings this baby for the 6-week visit, we are stopping nevirapine, we are starting septrin prophylaxis, but we are also testing the baby.
What is the purpose of this septrin?
It is basically to prevent infection. It helps to prevent infections in these babies. So like I said, we are mainly going to focus on the baby.
Yeah.
So maybe a little bit of background is that babies who are born to HIV positive mothers, most of them don't have HIV themselves. If the mother is actually taking her medications, currently the chances of her infecting her baby are so small, almost negligible. But this baby, because the mother is HIV positive, their immunity is a little bit not the same as the immunity of a baby born to an HIV negative mother. So they are given this septrin to kind of protect them against common childhood infections, because you find that because the immunity is a little bit not the same as the other infant, they are more prone to severe childhood illnesses. And when they get these illnesses like diarrhea, pneumonia, malaria, they are more severe in these children, even when they don't have HIV. So we have our baby, they are not HIV positive, but because the mother was HIV positive, their immunity is a little bit disorganized. So when they get these childhood infections, the common childhood infections, they happen to be more severe, and they happen to have maybe severe outcomes like hospitalizations. So they are given this septrin to try and protect them against these severe infections.
And I think this is the reason as to why mothers were fearing to breastfeed their children, because they are breastfeeding them and then they are falling sick all the time.
Yes.
So they think, and then when they give them septrin, they think, even my child is sick.
No, actually we have to remind our mothers that if you're taking your drugs very well, you can be an HIV positive mother and your baby is actually HIV negative. And you can breastfeed your baby. Currently we encourage you to breastfeed the baby for 1 year, and still you can breastfeed your baby and your baby will continue to be HIV negative. This requires the mother to take their ARVs as instructed by the health worker. Yes.
For how long is this baby supposed to be on the septrin?
So the baby is given septrin from 6 weeks of age, which is 1 month and a half, up to 18 months. Yes.
So after the 18 months, what happens? That is probably or almost 1 year and a half.
Yes. So we've worked with this baby, and during these first 18 months now we end up with 2 groups of babies.
Yes.
So unfortunately, some babies during these routine tests, they are found to be positive. But like I explained, with the effective drugs that we have right now, ARV drugs we have now in the country, very few babies now are getting HIV infected from their mothers. So, but there's still that small percentage that actually gets infected.
Could it be because a mother might have loosened somewhere? All research doesn't show why it happens.
Oftentimes, if you look back, you'll find that either there was a risk factor somewhere, and commonly it's either that the mother was not taking the drugs very well, or the mother didn't even know about the drugs, so she was not taking them, or she didn't attend antenatal. So usually those are the risk factors. Adherence to the drugs. So if a mother is missing the doses, is not picking her refills in time, that may increase the risk of infecting this baby. So that group is there, which it turns HIV positive. Maybe at 6 weeks, you test and the baby, the results are positive.
What then happens to this baby at 6 weeks if they test positive?
So if the baby tests positive, either at 6 weeks or at cessation of breastfeeding or at 18 months, this baby is is started on antiretroviral treatment, which is
does the baby also
ARVs.
take the tablet, or they give them a syrup?
So the syrups are usually available, but in case sometimes there are stockouts, and that is one of the challenges faced by the clinics. But they have their formulations, infant formulations, which are usually syrup. So
I thought they're also given tablets like those of old people.
Not really, because then you can't calculate the dose, because remember this is a small child and you have to give the medication based on their weight. So usually there are syrups for them. Yes.
Because I'm looking at a mother who would wish to share a tablet with the baby. After all, they are put on the same.
No, that's not encouraged, because they may be on different regimens. Because remember, there are also different drugs, and these drugs are given as combinations. So it's not just one drug. So there are combinations, meaning that several drugs are combined to make what we call a regimen. So the baby may be on a different regimen from the mother. Actually, even if you're both adults, you're not allowed to share these drugs, because you may all be on different regimens, different combinations of drugs. So we have that group where the baby turns HIV positive.
Doctor, I think time may not allow us to look at the other group.
Yes.
But what is your last word to mothers who have children who have tested positive in that period between 6 months and 18 weeks? Should they lose hope that their children are going to die, or?
No, so to our dear mothers who may have a child that turns HIV positive, we encourage you that actually this is not the end of the world. That drugs are available to treat these children. And actually, these mothers, sometimes when they go to this infant clinic, see older children who have been taking ARVs maybe from childhood, and they are even now at university level, they get encouraged. So this is not the end of the world. You're just encouraged to give your child these ARVs. Yes.
Wow. Let me clap on the behalf of the mothers.
Thank you.
Good news is your child is still safe. Even if they test positive, they're not going to die. They will live. Thank you so much, Doctor. Thank you so much, Makerere University School of Public Health, to always come in and rectify issues and give us correct information, because a lot of false information circulates out there. But when you come out and give us the true information, we are glad. Mothers out there, fathers, and the community at large are really blessed. We are also glad and happy.
Thank you, Edrine.
There are so many other programs that's still coming. You as students, go off Family TV. But as for now, I've worked with Jonah Jal, the producer, Bantam in transmission, and Brenda T. Yakira, together with Tony Santo on social media. Osteen Mukalazi is my name. Good night. Remember to follow the SOPs. COVID-19 is real. Put on your mask when you're moving out of your house. Wash your hands, and let us stay safe.